What is dyspareunia? Hi, my name is Martha. I'm a clinical sexologist with a doctorate in human sexuality, and I'm from Eros coaching. Dyspareunia happens to both men and women. However, it's more common with women, and it basically is a term that refers to painful sex. As long as it's any kind of pain, it is dyspareunia. And vaginismus is under dyspareunia. Vaginismus is a condition that happens when a woman's vagina shuts down, making penetration difficult and impossible. And so some people confuse pain as painful sex, dyspareunia as vaginismus. It's not the same thing. Vaginismus is what happens when you're not able to have penetration, and dyspareunia is what happens when you have pain, any kind of pain. And it's not just for women, it's also for men. So any kind of pain, and this pain is usually for the women in the vagina, in the labia or the clitoris. And you have any kind of pain, if it doesn't go away, then it may be important to seek medical help. One of the first things that you want to do when you are experiencing dyspareunia is that you want to look at the possible cause of pain. You want to look at your genitals to see if there's anything that is of concern, any lumps, anything that looks abnormal. So it is very important to actually look at your genitals so that you know what normal means. So then when you are having pain, you know what to look out for, to see if any kind of cuts or any bleeding, any soreness, tenderness that isn't usually there. So it's important to be in touch with our bodies. So when you have dyspareunia, when you have pain, you want to go and look at your genitals first, and you may want to see if it is something that, depending on what kind of pain, if it's very bad, then yes, you want to seek medical treatment as soon as possible. If it's something that you think might go away in 1 or 2 days, then go ahead, try and do that. But don't postpone it. Don't wait for 3 months, 6 months, because at that point, the pain has reached a point where it might become numb. The body doesn't let us put up with pain for so long. After a certain point, the body just gets used to it, and it becomes kind of numbing. So if you're having any kind of pain, then perhaps it's something physical that has happened, and it could also be something that's temporary, like for instance, a little cut or a little tear. And it's normal. The body is very resilient. The body will recover in a matter of time. What you can do to support with the pain, if there's any cuts, is you can actually use warm water to wash your genital region. It helps aid with healing. And you can put pure aloe vera on this area. It's from plants, it's natural, it's not likely to cause any harm whatsoever. So this is a little video about dyspareunia. At least you become familiar with this term. It sounds very technical and very scary, but really it is not. If you're having pain, then do seek the support of a medical professional. A lot of times when women complain about dyspareunia, any kind of pain, one of the first things doctors check is if you have a yeast infection, okay? And they might give you antibiotics. One of the things that I find really is very important whenever you take antibiotics is be very mindful that you want to also be taking probiotics. Antibiotics just wipes out everything. And probiotic introduces good bacteria back into your body. So be mindful when you're prescribed with antibiotics that you also want to be given probiotics. If you're not given probiotics, go and seek out what might be good for you. So this is Dr. Martha Tarali of Eros Coaching. If you have any questions, feel free to drop me an email, and you can email me at ask@eroscoaching.com.